Thank you so much, Katie, for giving us the opportunity to present on what we're doing in Ohio with our recruited practices around this Million Hearts ASTHO initiative. And what we'd like to share with you today is the practice change package that we provided to the 11 practices that we recruited in Ohio. And what I'll do is, the picture isn't very large on your screen, so what I'll do is kind of talk through a little bit about what's being asked for in each one of these tabs. We submitted to each of the practices a change package that is in an Excel sheet spread format. And just a little background before I get into it. Initially, when we recruited the practices, our goal was to hopefully get most of the practices on the same EHR system. And this way, and what we ended up recruiting were 11 practices with 4 different EHR systems. And because of that, we had to change our direction in how we were going to collect data from them, because not only they weren't similar EHRs, some of them did not have the ability, the integrated registry function within their system to pull data. And so we had to look at other ways to pull information on the ICD-9 groups and the measurements that we were asking for. So we came up with this option. It was a data collection tool that was developed by the American Association of Family Practice Physicians. And I believe one of our other state QIOs used this format with the 10th scope of work, PQRS and CV measures in collecting data from their practices. So we thought this would be a great tool for us to use in our instance. So on the first tab in this change package, we have a QI plan cover sheet. And initially, first, we had our event March 1st, where the 11 practices attended, and we asked them to provide us with some baseline data on that particular day. And first we asked for the number of total active patients 18 to 85 or older that were part of their practice. And the goal of obviously our project was to improve the follow-up appointment rates with patients diagnosed with hypertension, to address quality aim of blood pressure control reading that equals or is greater than 140/90, or less than 140/90 for patients with hypertension. And there were 6 data measures that we asked the practices to collect, and one was the NQF measure 18, and then also the number of active patients diagnosed with hypertension, then the number of patients with controlled hypertension, and then the number of active African American male patients with hypertension. Then also the number of active African American male patients with controlled hypertension, and then the number of active diagnosed hypertensive patients that have a follow-up appointment before they leave the office. And so we asked them to collect this baseline data, which was a collection period from 2/1/13 to 2/1/14. And then also on this tab, we were identifying some possible interventions that the practices could utilize during this process and during the project. And some of the interventions that we identified were to connect with our Summit County Health Department to assist their team in making follow-up visit reminder calls to patients. And then also we were directing the practices to utilize the Check It, Change It, Control It toolkit that was developed by the Ohio Department of Health and the Ohio Academy of Family Practice Physicians, and where they identified healthy behavior changes. And then also we suggested that they follow their team's new workflow office protocol for scheduling follow-up appointments, and then also to utilize patient incentives to compel compliance. So that was the first tab within this change package. Then we were asking, on the day of our training, our goal was to have each team identify a protocol that they were going to address and then begin identifying some of the action steps that they were going to take. And that's what this tab represents, and we were asking them to fill this out. And then this is the data collection panel where we're asking them to provide us these 6 measures for the data collection period March through June of 2014. And we had requested the practices to submit this to Kate Mahler by the 5th of each month. And my understanding, Kate, is we have received everyone's baseline data, and probably this week we should be receiving everyone's data for the month of March.
That's
so.
Correct.
Yes. Okay. Great.
Yep.
And then what we also wanted to provide our practices was a comprehensive list of resources and references that they could access to utilize within their practice, either to provide patient information, to share with the patients, or provider information. And also it provided access to the toolkit, a check, a change, and control a toolkit, and then also some self-management tools and so forth. So we just wanted to provide them with some tools that if they needed some educational materials, they had access to that. And then also we asked the practices at the end of the project to provide us with a post-program narrative. And there are about 6 questions that we are asking their input on, as far as such as, what activity were they successful in improving, and then we wanted them to describe in more detail their role in this activity, and what members of their practice team were involved in the activity. And but then there was also a section in here that I'll have Kate speak to, where we were asking for the names of the participating physicians who participated in the project, who were seeking ABFM Part 4 credit. And I don't know if you want to discuss that now, Kate, but
yeah, I'll probably just on a couple slides ahead, we'll definitely talk about CME and credit.
Okay. All right, great. And okay, here we go. So again, we were asking for our practices to develop a protocol to increase their follow-up appointment rates within their hypertensive patients. And again, we were asking them to submit this on a monthly basis, and hopefully by the end of our project we'll have some interesting results. So I will turn it over to you then now, Kate.
Sure. Thank you guys for participating today. For your reference, in your chat box, I put our link to the change package, as well as the entire Ohio Million Hearts project scope is actually available for you to look at, including the agenda that we followed for the team training day on March 1st, but probably more importantly, the connection to the change package that Gail shared with you. In addition to providing them a communication tool to collect data and communicate that back to me, who's compiling it for the overall project, we provided patient and practice incentives to be able to comply with what we were asking our practices to undertake. We provided our practices, and I should say we've not provided it yet, a $500 stipend for participation and follow-through until the end of June for our project, and making sure that we do collect the data on a monthly basis. But we did provide them on site at the training day a $400 stipend to use for patient incentives. And we took some time out of the team training to identify strategies on what practices might do for these incentives. For example, one practice used subway cards to talk with their hypertensive patients about making good choices at fast food restaurants, and Subway being one of those eating fresh potential incentives. Others were using their incentive money to provide gas cards for transportation to their follow-up appointments in their office. Others were doing raffles for regional or local activities. So by the end of this project period, they would draw a name of the patient and be able to award them for compliance with the project. So we really allowed the practices to be creative and find the solution that was right for their patients and their practice. And again, they will receive, at the end of the project, the practice will receive a $500 stipend for participation. And as Gail had alluded to, our team training day was accredited by the American Academy of Family Physicians for up to 4.5 prescribed credits. But probably the biggest carrot of participation in this, as far as physicians are concerned and credit, is that completion of the data collection portion and narrative report does qualify for the quality improvement credit through the American Board of Family Medicine and their maintenance certification component, Part 4. It is actually a new module format that the American Board of Family Medicine has provided to physicians to be able to do their own quality improvement work without having to follow a formalized module. Each physician who wants to claim credit will receive their overall data as well as a completed narrative and a copy of their protocol, all in a nice package so that they can report that directly to the ABFM, which is why we were really wanting to make sure that we have everybody's name as far as the physicians are concerned to claim that credit, even though they will need to do that individually on their own ABFM portfolio. I should also skip back to other incentives, and I know Gail had alluded to this, and I know we have a couple people from the Summit County Health Department online with us, but I would really say participation in our project also has a huge incentive, which is also working with the Summit County Health Department. On our website, you'll see that there are links to communication documents that the Summit County Health Department has provided to our 11 practices to be able to communicate the needs of their patients directly with the Summit County Health Department and help them make follow-up phone calls to those patients that have a follow-up appointment and be able to get them back in the office. And I really think that the partnership that we now have between practices and the local health department is key and should be really considered an incentive. At this point, I think we've kind of covered the change package and welcome any questions that you might have.
This is Mary Lou.
This is Kim. Go ahead.
This is Mary Lou Bolt from Vermont, and I was trying to read at the end of the slide around a web reference around ethical consideration in using incentives. Mm-hmm. And I was just wondering if is that what you used in preparation for possibly a policy on using incentives?
Actually, this incentive, work that we've done was actually piloted in our Check It, Change It, Control It toolkits that we piloted with the practices, and we wanted to have some basis for being able to provide incentives to these practices, and found that there is a white paper provided by the American College of Physicians discussing the ethics of providing incentives. Doesn't think as far as creating a policy, but I think it gives us some credibility and some standards to which to follow.
Great, that's helpful.
This is Barb Levin from Maryland, and I wanted to know whether you felt that how necessary these incentives, particularly the patient-based or even the practice one, whether they were as useful as perhaps just the recertification involvement. Could you comment on that at all, either Kate or yourself?
Sure. This is Kate, and we have that I alluded to earlier, a pilot project where we put our check it, change it, control it materials into practice, and we use subway cards as our incentive. We found that the practices that used the incentives were more successful in getting the patients to comply with the baseline and secondary measurement in our survey tool that we used. And so since we had the opportunity through this grant, we thought it'd be a good help to our practices if we did provide them a creative solution to provide incentives to their patients and let them figure out what's the best way of finding the right strategy to incentivize them. Having a little money was helpful in that cause. And I think as far as overall, having the ABFM Part 4 credit was what helped us in the end recruit the 11 practices in participation and keep them engaged throughout this change period. So we're doing really two different incentives, one to the practice, one to the patient. So I think they play well together hand in hand.
This is Gail, and I think initially when we looked at our recruitment plan and identified, first we were going to recruit practices that were part of the QIO 10th scope of work. As I said, we had a large group of practices in the Summit County, Akron-Summit County area that we had identified, and they were all on the same EHR. But unfortunately, we weren't able to recruit as many as we had hoped. And we thought that in addition to making it streamlined by everyone being on the same EHR, we thought if there were additional incentives, such as the stipend and the patient incentives, that might lure them into participating, given that many of them are involved in PCMH or ACO. That the list goes on and on of things that they're involved in that they're providing data for. So we tried to sweeten the deal and tried to, sell it to them that it's not only, assisting with this project and your patients, but, you'll get something out of it as well. So.
Hi, this is Tiana from New York. I was wondering if you could talk more about the local health department's role in this project, specifically how they received which patients to call and how they were funded, and if there was actually, if you've identified a sustainable funding stream. And did you have to get IRB approval for the local health departments to actually have a list of patients that needed to be reached?
Katie, would it be okay if we allowed Carrie Kernan to unmute her phone and speak to this? I see that she's on the call.
Oh, sure. Yes, she's welcome to speak to that.
Carrie, I'm putting you on the I was wondering if you could speak to that possibly for them.
I see her logged in on the web, but I'm not sure if she's on the line. So I can double check with her and.
I can definitely say, as far as when we engaged the Summit County Health Department, we had heard about the great work that they've been doing in their region. They are also a recipient of CTG grants and had already established quite an extensive portfolio of work in their community. As far as really Carrie is the one that can be able to speak to the grant funding, other than they were written into our grant for support. Hopefully Carrie's online now. We can definitely connect you after the phone call if you would like to address those questions with Carrie.
That would be great. Do you know if they had to have IRB approval or could you talk about how they
pretty sure that
got
is
the list
not.
of patients?
Yeah,
Okay.
the list of patients is actually a communication between the practice and the Summit County Health Department. There is actually a document on our website that helps facilitate that communication. The communication has to start with the practice office and allowing that communication to happen. The practice has to talk with the patient and allow that information to flow between the practice and the Summit County Health Department. And the documentation that, or at least the form that the Summit County Health Department provided is that conduit, be able to communicate directly between the practice and the office. And that is available for you on our website.
Thank you.
Sure. Sorry, we didn't have your full answer there. Any other questions?
All right. Thank you so much to our speakers for that great presentation and for all the questions as well. And Tiana, I do know we will have an upcoming call that I have the date at the end of one of the slides in our presentation here. But Carrie will be speaking specifically to Summit County's engagement in the Million Hearts Project and their locals' role on an upcoming peer group call. So at the end, you'll get the date and time for that. So there is definitely more information coming on that. And then, as Kate mentioned, the link to all of their materials, including the change package and everything, is available in your chat box. And then the link will also be sent out with the recording and the slides from the call today. All right. So